Welcome to our channel. Today, we're diving into an important topic, ambiguous genitalia. It's crucial to understand, especially for parents and expecting families. What exactly is ambiguous genitalia? It's when a baby is born with genitals that don't fit typical definitions. This can be a sensitive issue, and it's natural to have questions. We're here to break it down for you. We'll discuss the causes, diagnosis, and prevention of ambiguous genitalia. We'll use clear explanations and avoid medical jargon. So let's start with the basics. What exactly do we mean by ambiguous genitalia? Well, it's a term used to describe a range of conditions where a baby's external genitals don't appear typically male or female. This can include things like a clitoris that's larger than usual, a penis that's smaller than usual, or a scrotum that's not fully formed. In some cases, a baby might be born with both ovarian and testicular tissue. It's important to understand that ambiguous genitalia is a spectrum. This means it can range from mild to more complex presentations, and it's not a disease in itself, but rather a difference in development. Ambiguous genitalia isn't a one-size-fits-all situation. There are several types, each with specific characteristics. One type is congenital adrenal hyperplasia, CAH. CAH leads to an overproduction of androgens, male sex hormones. This can cause masculinized genitalia in XX chromosome babies. Another type is androgen insensitivity syndrome, AIS. In AIS, XY chromosome babies are insensitive to androgens. This can result in female or ambiguous genitalia. Now, what causes ambiguous genitalia? Well, it's a bit like putting together a puzzle. There are several pieces that can contribute. One of the most common factors is genetics. Sometimes babies are born with chromosomal variations that affect their sexual development. Another piece of the puzzle is hormones. Remember how we talked about androgens, those male sex hormones? Well, during pregnancy, the levels of hormones in the mother's body and the developing baby can influence the development of genitalia. It's not always just one thing though. Sometimes it's a combination of genetic and hormonal factors, along with other environmental factors that we're still learning about. Chapter 4. Let's talk about risk factors. While it's not always possible to pinpoint the exact cause of ambiguous genitalia in every case, there are some factors that might increase the likelihood. One risk factor is a family history of disorders of sexual development. If a family has a history of conditions like congenital adrenal hyperplasia or androgen insensitivity syndrome, there might be a higher chance of it occurring in future generations. Another factor is exposure to certain medications or substances during pregnancy. For example, some medications used to treat epilepsy or hormonal imbalances have been linked to an increased risk of ambiguous genitalia in babies. Chapter 5. Diagnosing ambiguous genitalia. Diagnosing ambiguous genitalia starts with a physical exam after birth. Doctors examine the baby's genitals for variations from typical anatomy. Sometimes the diagnosis is clear right away. Other times further testing is needed. This includes blood tests for hormone levels and genetic tests for chromosomal variations. Imaging tests like ultrasound examine internal organs. These tests help determine the cause and guide treatment. Chapter 6. Prevention and Precautions. Now you might be wondering, can ambiguous genitalia be prevented? The truth is, it's not always possible to prevent it entirely, especially when it comes to genetic factors. However, there are some precautions that can be taken, particularly during pregnancy. For example, maintaining good prenatal care and discussing any family history of disorders of sexual development with your doctor is important. Additionally, if you're pregnant, it's crucial to talk to your doctor about any medications you're taking, including over-the-counter medications and supplements, to ensure they're safe for pregnancy and won't interfere with fetal development. Chapter 7. Importance of awareness and understanding. Awareness and understanding are key. Ambiguous genitalia is complex and sensitive. Approach it with empathy and sensitivity. With the right support and care, individuals can live fulfilling lives. Reach out to your healthcare provider. They can provide support and resources. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more informative content. And remember, knowledge is power. The more we understand about ambiguous genitalia, the better equipped we are to support those affected by it. We know that dealing with a topic like this can be overwhelming, so if you have any questions, please leave them in the comments below. We'll do our best to answer them and provide you with the information you need. Until next time, stay informed, stay healthy, and take care of yourselves and your loved ones.